we're going to try to cover three goals here: the rationale for robotics, the execution of robotics, and then what the future of robotics and spinal surgery is. So the reason that I got into robotics is my passion for patient safety. You know, I look at a slide like this and I think to myself, how can we prevent stuff like this from happening? How can we keep our patients with a situation where they're getting the outcome that we want? How can we make our surgery better and safer? And it's my belief that employing these technological advances, like robotics here, we're going to make surgery better for everybody. It was that passion that led me to get the first robot in the Pacific Northwest and to do some cases. And my experience with the robot now over several years has shown me that we really are able to make things faster and safer and better for the patients, get better outcomes. Now, spinal surgery is a performance art. And by definition, 50% of spine surgeons are below average, 50% are above average. And it's my belief that the employment of robotics, much like a tide will rise all boats, will increase the level of our art form. And I think about like a Stradivarius. So if you had a Stradivarius and you gave it to a high school violinist, they're going to sound pretty good. I mean, way better than they are on their school beater violin. But you give it to Isaac Perlman, all of a sudden things are singing. And so for the average or below average spine surgeon, the employment of this type of technology will bring them up to our standard of care and truly will raise the standard of care in instrumented spinal fusions. We get people like the surgeons in this room, and all of a sudden we are creating art. We are going to have wonderful things coming this way. You know, I think the master surgeons are going to be able to unlock the potential of this technology and take this places that are very, very exciting. If we remain under the incorrect idea that screws aren't being misplaced, that things are going fine, they're hunky-dory, I've placed 10,000 screws and I've never had a problem, all we have to do is look at the literature to see that that's not the case. We actually have seen many, many studies that show that there's a misplacement rate anywhere from 5 to 10%. And freehand, MIS, it doesn't matter. When you look at it, screws are being misplaced. And if we ignore that fact, we are doing a disservice to our patients. Radiation safety. Radiation exposure is a real thing in the OR. And one of the neat advantages of robotics is we can really limit how much radiation is exposed to the patient and to the staff that we work with, that we care about. You know, the scrub tech whose, you know, his kid's graduation party you got invited to. Like, these are real people and we want to prevent damage to them. So both Generation 1 and Generation 2 robotic technology dramatically reduce the amount of radiation that our staff is exposed to, and our patients and ourselves. So, the rationale for robotics. We're going to work on improving patient safety as far as placements of the screws, patient and staff safety on decrease of radiation. But does it really do what we say it does? So this is an early study looking at a Gen 2 robot on accuracy of screw placement. This is how they measured it. They actually took the preoperative plan and then superimposed the postoperative CT scan to look for accuracy. And if you look, you'll see that there's one screw that's off. It's panel D. It's on the right, second one down. It's off by 2.1 millimeters. And the way that that's off, if you'll notice, is called the skive problem. And essentially, where they meant to start the screw was at an angle, and they skived off. But this is their conclusion was that this robot allowed for accurate placement, and they were essentially perfect except for the one screw, and that one was only 2.1 millimeters off. And there's a grading system that people use for this, and that actually falls within a grade B of a grade A, B, C, or D breach. Shortly thereafter, this paper was published addressing issues that show you how you can avoid that skive problem. So there's a special drill bit you can use, which you'll have a chance to see here, that cuts on the side. So even if you are trying to get your drill to go in on an area where it could potentially skive off, it won't do that. And then there's the neat addition of the Skive-O-meter. This is the Irish component of the robot that will tell you if you're deflection. And this is something that...
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.